So this is a 60 years old male. He's a known case of hypertension, diabetes, and tobacco cheer. And he's a known case of inferior wall MI 1 year back, and he's a status post PTCA 1 days to the distal RCA. Now he presented with again ST elevation in the inferior lead 2-3 AVF, and this is the angio. This is a eleocaudal view, and he's a status post PTCA to OM1 also that time 1 year back. So with the right radial root we did the angiogram, and this is the, you can see the LED is okay, and in OM1 before the stent there is a 50-60% stenosis. This is a arrow caudal view, and near the arrow you can see the stent is there. It is grade 1 ISR, stent is patent in this OM, and LED there is a non-significant mid LED lesion. And this is the cranial view, and you can see mid LED there is a 50% stenosis. So this is a epicranial view, and this is the areocranial view, and you can see the in distal RC there is a stent, and there is a complete total thrombotic occlusion in the RCA. You can guess from this angio. And this is what we expected. There is a 100% total occlusion before the stent, and in mid RC there is a thrombus, and you can see the shadow of stent in the mid to distal RCA. So this is a still frame, and you can see just near the arrow there is a 100% thrombotic occlusion, and there is a probably thrombotic lesion here in the mid RCA. And here what we are seeing is the catheter is up to here, so this is a probable vasospasm. So there is no lesion probably in the proximal, but it is a thrombotic lesion right from the mid RCA, and this stent before the stent there is a 100% thrombotic occlusion. And this is again the cranial view, and you can see the same view. Probably the stent is in the distal RCA, right from the RCA to PLV. Probably after opening only will come to know. I wanted to see whether that proximal RCA has a spasm or not, so I removed the catheter while giving the contrast, and you can see that the spasm has gone. So just we have given the NTG, and I have removed that catheter. So you can see there is this was the catheter induced spasm only in the proximal RCA. So what is your plan of management in this case? We have given them plan of PTCA to RCA right away, but they're not willing at present, and patient is for time being is stable, BP is stable, no heart block on the ECG. So they'll decide, and so what is your plan of management in such cases? Kindly comment your plan of management in such cases. Thank you.